Hindu Leather Jayapal. We are going to have a class on infection control. So let me just go to the next slide so you can see that. So you know what, we have two kind of pathogens that invade our body, bacteria and viruses. So we should know the difference between the two of them. And viruses cannot be treated by antibiotics. Bacteria can be, but I'm going to show you a slide that is going to explain it all to you, okay? So
infectious diseases are caused by microbes. These are small organisms which are invisible with the naked eye and invade your body to get multiplied. The symptoms caused by an infection depend on the location, nature of the infection and type of the microbe. The two major types of microbes are the bacteria and the virus. Viruses are the smallest in size of all the microbes. They are able to attack almost any living organism. A virus uses another organism like a human being as a host. It means that the virus invades a cell of the body and uses parts of the cell to multiply itself. In this way, hundreds of new viruses are produced, which can spread throughout the body. They can also infect new organisms. Viruses can't survive outside the body of the host for long. They can only survive a few seconds to minutes after leaving the host. Bacteria are much larger than viruses. They live almost everywhere, and many of them don't cause infection. A bacterium multiplies itself by division. If the conditions are favourable, temperature, nutrition, some bacteria can multiply after every 20 minutes. Your intestines contain large number of bacteria. Normally, these bacteria don't cause any problem. Actually, they're quite useful in various ways, like digestion. But if you have weak immunity, the balance may become disturbed, and complaints like diarrhea, constipation, or cramps may occur. Viruses and some bacteria can cause infections. Locally, an infection causes redness and swelling. The tissue may also become warm and painful. Common symptoms of a viral or bacterial infection are fever, fatigue, and general malaise. Mostly, viral infection is simple and the complaints subside by themselves. It is difficult to eliminate viruses. Specific medicines have been developed only for certain viruses. Also, an infection usually resolves by itself. If this is not the case, the physician can prescribe antibiotics. An antibiotic is only effective against a bacterium, not against a virus. It is important to prevent the spread of microbes. Good hygiene can play an important role in prevention. Regularly wash your hands and cover your mouth with tissue paper or cloth whenever you cough or sneeze. Take proper care of little wounds by disinfecting with iodine or alcohol.
all right. So you now understood the difference between a virus and a bacteria and how they get into our body. So to get in and how we get sick with them. So let's go to the next slide and see what we can go from there. Well, this is another one explaining the way to break the chain of getting the thing into our body, the viruses and the bacteria, is to wash our hands. And that is why we wash our hands constantly, in the nursing field especially. So now we come to infectious diseases. So infectious diseases are also referred to as contagious diseases because we get them. Contagious is what we get from another infection. They are also referred as communicable diseases because we get it from the community. these diseases in the community are required, but we get them because the infection spreads from one individual to another. And the most common one, what we see in the community, is MRSA. The other name for the technical name for MRSA is methicillin-resistant Staphylococcus aureus. But we will talk about it as MRSA because you know, and this really affects the skin or wound, or that is how we see it. And usually these people, if they come into the hospital, they are put into contact isolation. And what the best way to prevent that is to avoid direct contact with the individual who has it. So a direct contact is when we are touching somebody or touching the individual with bare hands. And an indirect contact is like we would touch their table or their utensils or remove, their eating utensils when they come to when they come into the hospital, we are taking care of them. So the best way to do is to wash your hands, put on your gloves, and then do whatever you can. But outside the room, they will have a sign, or they will tell you what you need to wear and go into the room, which is, they will, the infection prevention for it. But before we go over there, let us talk about colonization, infection and colonization. And then this is how you would prevent not going too close to somebody. See how everybody is exercising? We don't know who has MRSA there, and they are all holding on to everybody. So now we have infection and colonization. I'm sure you've read that in your book. But infection is a condition that results when microorganisms cause injury to a host. And who's the host? It's the individual. And colonization is a condition in which the microbes are present, but the host does not show that any signs and symptoms of it. So that is kind of a little bit of a thing you should know. It makes it easy for you to understand. And in this slide, we can see the difference. Colonization it starts in our throat or in the nose or in the GI tract. It starts somewhere within our body, and then it causes an infection. If we have it it goes to the respiratory, it goes into the lower respiratory tract, and it goes into soft tissues. It can also have an effect on giving us a shock, a toxic shock. Then the way we get all these things that enter our body is through either we can get an injection, or you can have a catheterization, or you can have other source of, your skin is a protective agent, as an organ in your body. But when there's an injury and you get it and there's an opening in your skin, something enters our body, and that's how we get infection, okay? So, but this infection can also move around in our body. Some people get an abscess, some people can get abscess in the brain, some can get infection in their kidneys, some can get it in the spinal cord. But this is how, and then eventually all this, if it is not taken care of, it can eventually give us a toxic shock. So that is a small scenario of that. So then there are 5 stages in the course of infectious disease. So the 5 stages are incubation. Incubation is when the infectious agent reproduces. They have to get into a host where they will reproduce and they will multiply. But at that time, there may be no symptoms of it. And you don't even know that the infection is existing in our body. Then we have the poromal stage, which is the initial stage symptoms which appear, but they may be very vague. You may have a headache, you may have fatigue, you may have slight temperature, but there's nothing specific about it. Then you come to an acute stage. The acute stage is when the symptoms become more severe, and you will understand that it's specific to an organ. So, say if you have high temperature, then you will say, yes, she's getting an infection. So you go to a doctor and they do all, they do some tests and things like that. But they will find out after the acute stage where the infection is. And after the infection is over, then we have the convalescent stage, where a person is recovering from the infection. Then we have last of all is the resolution stage. That is the stage when we come back to our normal self and the infection is out of our body. So these are the 5 stages of an infectious disease that an individual suffers or goes through. Then we have the chain of infection. This is, it has to be linked one to the other. As you see, the chain goes. We have a pathogen, then it needs a source to enter. Then when it enters the body, it needs to travel. But it cannot travel on its own. It needs a vehicle to travel, and that vehicle it finds, it will come into it will latch on to a pathogen in our body, and in that how it enters our body, and then it becomes a host, and that is the chain that happens. But to have this chain and a continuation, the link has to be together. If we break it, how can we break a chain of infection? It's to wash our hands, and so we can prevent this happening. But that is where that's what it happens with. All right, now the next thing is there are 2 standard techniques to prevent infection, and that is a standard precaution and a personal protective here. This is what we spoke about. This is the portal of entry, the causative action, then the source, the reservoir, the port of exit, then the mode of transmission, then the portal of, and the susceptible host. Okay. Now here are the 2 infection controls. As nurses, we need to be aware of this. Okay. So infection control are measurably and employed to reduce we use this to reduce the infection spreading around in the hospital or to one another or to anybody else. So the way of reducing this is we do practice this to reduce the infection of blood or body fluids or secretion or from a wound. The standard precaution includes hygiene, using gloves. Most of the time is using gloves, using a gown, using a mask, using an eye protection, or we use a facial shield on our face if there is too much of fluid. If you are suctioning somebody, then you don't want that to splashing on your face. And then there's a safe injection practice because people get injections, and the injection practices are very what would I tell you? Like it is when we are giving an injection, we have to make sure we use a single syringe. We don't use it for different people. One syringe for one person, one individual. We use the single vial dose, so the dose is just correct and it's not over or extra. So that's one of the precautions. Then we come to personal protective equipment. This is otherwise called a PPE. This is an infection. PPE includes a mask, a gown, gloves, shields, things that will protect us from getting the infection. Now this is used, you will see this when you go to do your clinical, and outside the room you'll find a poster like this, and they will tell you whether you need a mask or you need a glove or you need a gown. Whatever you need, then you follow what is written over there. Then it is very important, especially for a cough, for respiratory, because people cough, and when we cough, we are throwing out our germs. So we use either a tissue or a hanky, or if you don't even have a cloth, then you can even sneeze in your elbow to prevent it from spreading to everybody. the moment we use a tissue, what are we supposed to do? We are supposed to dispose it in the garbage can and not leave it. When you go into the nursing home, onto the hospital, you'll see some people, they cannot get out of bed, and this tissue, the garbage can is far away from them. So what we do is you have little disposable plastic bags on the floor, and we tape it onto their nightstand, and so they can throw it in there. So it's not, doesn't touch anything else. And then you perform hand hygiene. Then you use a mask. There's also a mask. There are different kind of masks. There is a mask which you use for when you're going into the person who has TB. That is called N9. It's called N95. And then we have another one which is an example of a respirator. It is a powdered one which you put on your mouth, and you sit in the room when you're in there talking to somebody. So that's one of those. When do we use this is the protective clothes, and I spoke about the hygiene and the cough. And you're supposed to stand 3 feet away from somebody, whoever has the infection. Don't go too close. Sometimes you can't help it. You have to go a little closer if you cannot reach the individual, but as far as possible, try to keep something that you can pass them or extend your, through a, try to keep that distance of 3 feet. That is important. Sometimes you can't, so we use a nightstand or something to pass things to them. Okay, here is one for sneezing and coughing. So you can look at it, and you know this, but it's a nice picture for you to see. And here is a disposable, how to get rid of the stuff, all our tissues. Okay, here is the injection I was talking to you about, the practices of a safe injection, especially this is also to prevent hepatitis B. Commonly we call it HBV, and hepatitis C. And of course here it is that we use it as a single dose. We use a single syringe, and we make sure that the sharps are disposed of in a sharp container. You can't have it lying around. So we always make sure there's a sharp container there. This is a lumbar puncture. Can you see everybody dressed as in a sterile field? You will see this if you work in a hospital. Everybody is covered, and the patient is covered, and there's a small little opening here at the back where they are cleaning it, and they will perform the lumbar puncture just here. Can you see the nurses are all dressed in gowns, and the doctor, everybody's covered. This is to prevent any infection going there. And this is done really mainly for people who have, they're checking out why the person needs it, so they're checking out either for meningitis, or they usually see for meningitis or pilomelogram or something like that. They do the test like this. You'll see it if you work in a hospital. It's very common there. Now let's go down to the different kind of precautions we will follow when we go into a hospital. As LPN students, when you all go into a hospital, so airborne precautions. Let's hear. This is very important because this is something you will experience when you go into a hospital. This is a precaution used to prevent and block pathogens which are suspended in the air, and the size you should know, that is very important. It is 0.3 microns or smaller as well. They are attached to the dust particles. TB patients need a private room, or they can even be in a room with a patient who has a similar kind of an infection. But you must maintain a distance of 3 feet between them. And the clients who come to visit them and the visitors who come, they must keep a distance of 3 feet. And this is the mask I was telling you about, N95, or a powdered air purified respiratory mask. You put it on your face and you sit with it covered in the room when you're giving care to the patient. You will see that when you ever come into there. And then of course this is really for people who have TB or measles or chicken pox or SARS. You know what SARS is? It's severe acute respiratory syndrome. Measles is now on the rise, right? There's new cases of measles coming out, so you may find a lot of, you may come across somebody who has it. Here is a droplet one. So the droplet one is a precaution that reduces pathogens transmitting close to the contact with that has respiratory secretions, mucus or membranes of an infected person. This infection is spread through droplet microorganisms. And the precautions we have to take is to standard precautions, which we know is washing our hands and using gloves, wearing a mask, entering a room and before we enter the room, we must have all this on before you enter in, because that's where you're going to get the infection. And we have to maintain a distance of 3 feet. Okay, and then the client, if a client has to go for any place for a test, then you make sure they have a wet mask before they're traveling they go. And then this is diseases you will find are influenza, rubella, streptococcal pneumonia, and meningococcal meningitis or whooping cough. Whooping cough is another one that is on the rise now. Then contact is the most common kind of a precaution you'll come across. This is when we are preventing direct contact from a person. And this is a person who's colonized and doesn't know they have the infection. And the germs don't show, the infection doesn't show. So for them also you don't know whom you're taking care of. So the best is to protect yourself and protect the patient, because you don't know, the patient doesn't know what you have. So it's protecting both the patient and yourself. As nurses, so you always have to wear gloves before you enter the room. And the most important thing is also change gloves in between. Don't use the same dirty gloves to continue giving care. If it gets dirty, change it again. And then wear a gown if you're entering a room who is incontinent, or if they have diarrhea, or they have ileostomy or a colostomy or any wound drainage. Why do we wear a gown? Explain it to me. So we don't get any infection coming on to us. And then when we are leaving the place, we have to remove, before we leave the room, we have to remove our clothing. Now the purpose of this is the PPE is to prevent infection. And the way is you have to wear it. How do you wear the gown? You wear the gown, you tie it at the back and you tie it at the waistline. And you make sure your wrist, the wrist is, when you put your gloves on, it covers the cuff, because the cuffs they're tight over here, they fit your wrist. And what else is there? Then the precaution of the face, it is very nice to say over here to use a face mask and a respirator, but people like me who use glasses, it can be very, very difficult, but at the same time you have to use it because you're taking care of somebody with this, and eventually you develop a knack of doing it, and you can do it, because I've done it. We've sat in a room doing dialysis for 4 hours with people all dressed up like this. And then of course you have your gloves, and then you always wash your hands before you put a glove on, and then you always remove it. And when you're leaving the room, you never walk out with a glove. You always remove it, and then when you come back, you put on another pair of gloves. Never walk out of the room, oh my gloves are clean, I'm going to get something. That's a big no-no. All right, so let's see the next one. Now this is important, how you remove your thing, because you will be removing it, and you should make sure you remove it so that you're protecting the patient and you're protecting yourself. Now when we are finished with the patient, what is happening to us? What is our garb? Is it clean or is it contaminated? It's contaminated. So what is the most contaminated part of this garb that we wear? things that we do, what do you think is the most contaminated? It would be the gloves, isn't it? Because we use the gloves the most. So you remove the considered the most contaminant. It is recommended by the Center of Control and Disease to remove them first. So the first thing you do is remove your gloves. And how do you remove your gloves? You hold on to the edge of the glove and you remove it, and you hold the other edge and you fold the gloves one into the other, and you discard them. And then you remove your goggles or your shield, whatever you're protecting your face with. Then the last of it is to remove the gown. You remove the gown by handling the portion of the gown where the gloves were on top, because this is considered clean. The rest of your gown is dirty. So you remove this and you take it out slowly, fold it all into a small, the thing is to fold the gown up. So you're not spreading the germs by shaking it. So you fold it up and put it into they have the bins over there, and you put it into there. And then some people even have to wear shoes and caps because they have to protect their hair, so you remove that. And then the last, why would we remove the mask the last? Can anybody think of why?
So you're not breathing in the contaminants.
Very good, so you're not breathing in the contaminated thing. And then you remove all this, and then you wash your hands and you leave the room. And then the last of it is, here, this is how, can you see this bag? They have a thing called double bagging. Sometimes you need two people to do that. So this is the lady who's in the room. She's got all the infection stuff here. And this young lady is helping to hold the bag, and she's putting in the contaminated stuff into the bag, and then they fold it and they take it, and make sure you always have your gloves on. And this is how, there are two receptacles here. This is a sharp, and when you're opening the other one where you're putting things, make sure you use the pedal. You don't touch the cover. Okay? Now, when a person is in isolation, don't you think they feel very lonely? Or say, so what's the last thing what is the thing to make a person feel not lonely and not to feel that they are segregated and they're still a part of us?
To visit them.
To visit them. So you can make sure they have a TV in their room. They should have a phone so they have a contact in case they want to talk to a nurse outside or they want to call their family. So a TV, a phone, and you also encourage people to come and visit them. Sometimes if they don't have family members or they're in a strange place, there's always people in the hospital who come and visit. So you can always call either the church, they have various religious groups in the hospital. Even in the nursing home, they will have people, they have a rabbi, they have priests, they have Roman Catholic priests, they have different denominations, they have even people from the Islam faith. The people come there and visit them. So whatever the religion is, and if they can get somebody to come, they arrange for that. And so we have to make sure that the person is with us and they are not isolated and they're comfortable.
Personal protective equipment should be selected based upon proximity to the patient and the likelihood of contact with any blood or body fluids during procedures in the patient care area. This video will demonstrate the proper sequence for donning and doffing personal protective equipment from the Centers for Disease Control. The first step in donning personal protective equipment is good hand hygiene. The second step of the procedure is donning the gown. The gown should be fastened at the back of the neck and the waist by tying a bow. The third step is the selection of respiratory protection. One option might be a procedure mask. Procedure masks are used for droplet precautions. Droplet precautions are used in the care of patients with influenza. To apply this mask, gently crease the metal insert to create an indentation for your nose. Then cuff the elastic bands around your ears and spread the mask to cover your face from the bridge of your nose to below the chin. Finally, ensure the mask is snug and comfortable on your face. Procedure masks also come with attached eye protection. This mask is applied in a similar fashion. Respirators act as a filter to prevent small particles from entering the airway of the person wearing them. A respirator should be fit tested annually in order to ensure a good seal. The properly sized respirator should always be used. Place the respirator on your face and position the straps at the back of the head and at the base of the neck. The elastic straps should be in contact with the skin on your neck, so remove any hair that is in the way. Press the mask along the edges to seal it to your skin. Finally, breathe deeply in and out, feeling for any areas where air may be escaping along the edges. Respirators can be shaped to fit the face or be folded. Folded respirators are applied in a similar fashion, ensuring that the respirator is fully unfolded and has a tight seal with the skin. Again, breathe deeply in and out, feeling for any areas where air may be escaping along the edges. Facial hair will prevent the respirator from making a tight seal with the skin. Even a small amount of stubble will compromise the seal and reduce the protection provided by a respirator. If the respiratory protection you selected does not have attached eye protection, eyewear should be selected next. Protective eyewear might be safety glasses or goggles. Many shapes and styles are available. The final step in the procedure is the application of gloves. Ensure that the cuff of each glove covers the wrist of the isolation gown. A secure fit will prevent gapping while providing care to the patient. Before entering the room, ensure all personal protective equipment is in place and comfortable. This will prevent you from adjusting your personal protective equipment while in the patient care area and potentially contaminating unprotected areas of your body. You are now ready to provide care to your patient. The first step in the procedure to remove personal protective equipment is doffing the gloves. Gloves are removed first because they are likely the dirtiest item and are contaminated on the external surfaces. Grasp the first glove on the external surface at the cuff and gently peel off. Hold the removed glove in the gloved hand. Then slide a finger of the ungloved hand under the remaining glove, touching its clean side only, and gently peel the second glove off over the first glove. Discard the gloves in the trash. All movements in doffing should be slow and intentional to prevent the aerosolizing of any contaminant on the used equipment. The second step in this procedure is to remove your eye protection. The glasses or goggles are contaminated on the outside, so touch only the earpieces or elastic bands while removing them. Eye protection should be placed in the trash or be placed in a designated area for reprocessing. The third item to be removed is the gown. The most contaminated areas of the gown are the front and sleeves. Unfasten the ties at the neck and waist, then remove the gown by slowly pulling it down and rolling it away from the body with the clean side out to form a bundle. Use the foot pedal to lift the lid on a linen hamper. Then place the entire gown inside the bag. Disposable gowns may be discarded in the trash. Be sure that the entire gown is inside the trash can. Gowns left hanging are a risk for contamination. The fourth step is the removal of respiratory protection. It is removed last to prevent any transmission of contaminated particles to your respiratory tract while removing the other equipment. Touching the front of the mask or respirator should be minimized during removal. When a mask or respirator has two elastic bands, remove the bottom one first. Discard the mask in the trash. Finally, perform good hand hygiene immediately after removing all of your personal protective equipment.
I'm covering my hands with a cream that glows under ultraviolet light. This represents the bacteria that is normally on your hands. If I then quickly wash my hands, and replace them back under the ultraviolet light, you can see where the cream remains in the creases of the skin and around the fingernails. By pressing fingertips on the agar plate, some of the bacteria on the hand are transferred onto the jelly. The agar plate is incubated overnight, and this is the result the next morning. Each little white dot is a result of one bacterial cell from the hand multiplying millions of times overnight. Your clothing, jewellery and watches carry bacteria, so they mustn't come into contact with patients. Before you clean your hands, roll up your sleeves, tuck in your tie if you have one, take off your wristwatch and any rings with stones or ridges on them. Only smooth wedding rings like this one are acceptable, but you still need to clean under and around them. To squirt some alcohol hand rub into the palm of one hand, rub the fingertips and the fingernails into it, spread it into the palm of the other hand and do the same with the fingertips and the fingernails. Make sure that all surfaces of the hands are covered, the outside of the thumbs, and keep rubbing until the alcohol hand rub has dried. The amount of rub that you use depends on the size of your hands and the brand of alcohol. Put the rub into the palm of one hand. As you spread it across the palm with your fingertips, you're starting to decontaminate both the palm and your fingertips. Pass some onto the other palm and spread it with the other fingertips. Now work on the back of both hands and in between your fingers. If you are wearing a wedding ring, make sure that you clean around and under the ring. The idea is to cover all the surfaces of both hands up to the wrists and keep rubbing until the alcohol dries. Wet your hands using warm but not hot water. Use about a teaspoon of soap, covering the palms, working in between the fingers. Again on the backs of the hands, in between the fingers. Interlock the fingers so that the fingernails are cleaned. Cover the outside of the thumbs and up to the wrists. This should take about 15 seconds or 2 to 3 verses of Happy Birthday to You. Rinse well and dry the hands thoroughly. Turn off the taps either using the paper towel or your elbow. Avoid a common mistake. Make sure that you open the bin with your foot, not with your hands. It's important to wet your hands with comfortably warm water before you put the soap on. This stops the soap drying out your hands. Use about 1 teaspoon's worth of soap. Rub the palms together to make sure they're completely covered with soap up to the wrists. Then rub between the fingers. Now use your palms on the backs of the hands and again between the fingers. Next, to clean the fingertips and nails, interlock the fingers and ripple them like this and rotate them against each other. Finally, rub around the outside of each thumb. The whole process should take about 15 seconds. Rinse off all the soap with water and dry your hands carefully with a paper towel. Dry the palms and backs of your hands to help remove any remaining bacteria. Work the towel between the fingers and underneath and around your nails. Use the towel or your elbow to turn off the tap. Open the pedal bin with your foot to dispose of the towel.